Hello, everybody. Welcome to the end of day 2 for our Veterans Week. Today we have a great panel. So the Michigan Medicine Veteran Panel is here to join us today. They are among over 700 faculty staff that we have on the University of Michigan Ann Arbor campus who are veterans who have prior service. So they work, not only are students among you, but we actually work among you as well. And so this panel is from our Michigan Medicine side of the house. And we're happy to have you here today as part of our Veterans Week, very much. And so thank you everybody for joining us. We have Jenna Long is going to be our moderator tonight, and I am going to turn it over to her. And Jennifer.
So let me hop in.
I'm sorry, Jennifer Lamb too. Sorry.
That's okay. That's okay. Let me hop in real quick and just kind of introduce myself and Jenna. So we're going to help moderate this. Anytime you have this many talented doctors, nurses, medical professionals, you need two people to moderate it. It's too much for just one. So my name is Jennifer. I will help Jenna with moderating this today. Just so you guys know a little bit about me, I am a Marine Corps veteran. I served in the Marine Corps for just about 10 years, and I've been at Michigan Medicine for about 8 years. I work in a program right now called MSPAN, Military Support Programs and Networks. And Jenna, can you introduce yourself for us too?
Yep, absolutely. So I'm Jenna Long. I am an academic advisor at the University of Michigan School of Nursing. So I work with graduate and professional programs, our master's students, doctorate students, as well as doctor of nurse practice programs. So I don't have a military background, but I have been committed and passionate about working with our current veteran students, engaging with our veteran alumni, and certainly look forward to opportunities similar to this where I can connect with a broader military community. So thank you for joining.
Jenna and I are going to take turns introducing some of the panelists that we have here. So Jenna, I'll let you take it away with the first one.
Absolutely. So first we have Cassandra Aebersold. She is actually a critical care nurse. Well, she was in the Navy and worked as an educational nurse coordinator in the adult emergency department at Michigan Medicine. Cassandra, do you want to say hi and maybe showcase one of your beautiful photos that you provided us with?
You tricked me. I went last in the meet and greet.
This is true.
So I joined the Navy straight after nursing school in 2009. I was initially stationed at what's now Walter Reed National Military Medical Center, but at the time it was just Naval Hospital Bethesda. I was there when the Army moved in with us. I worked in the surgical ICU there, taking care of a lot of the wounded guys coming back from Afghanistan and Iraq. And then I went overseas to Guam for a few years and worked in an ICU there. And then I actually switched to the reserves in Guam, and I'm still active in the reserves. So I drill once a month on the weekend. And I actually deployed in 2018. So I was gone for about 8 months total in Iraq on a deployment. And yeah, that's about it for me. I work in the ER.
Excellent. We're going to have a chance to ask lots of questions and to have the people that have joined us ask questions. But let's figure out who else is with us. The next person is Matthew. I saw you calling in there. Could you unmute yourself for us?
I'm unmuted.
All right, awesome. So just a quick introduction. Matthew is a surgeon in the orthopedic surgery at Mott Children's Hospital, and he did serve in the Navy from 2009 to 2019. Can you tell us a little bit about yourself and maybe tell us what's going on in this picture here that we have of you?
Excellent. I joined the military in 2005 when I started medical school, and it was in a health professional scholarship program from 2005 to 2009. So then when I graduated medical school, I went into orthopedic residency at Naval Medical Center, Portsmouth in Virginia, and I completed my residency in the Navy at the Naval Hospital. And then I went back to that hospital after subspecializing in pediatric orthopedics and years in 2019. The picture on the left is return deployed on the UNS Boys on one deployments. I think that one was after going to Puerto Rico, but I'm not exactly positive.
Your audio cut out just a little bit there, so I'll kind of highlight too. So if any of you did
Oh, I'm sorry.
try that again. Tell us about this picture, because I do love seeing this picture of you coming off of your boat.
Yeah, I apologize. See if I can. I'm driving, so I apologize about any loss in signal. Again, I was deployed on the UNSN Comfort multiple different times. Once to Puerto Rico, and then once on a humanitarian mission to Central and South America. And that is just me returning from one of those deployments, and my 3 boys walking away from the ship.
Excellent. Thank you so much. Let's see who's next. Jenna, can you introduce?
Yeah, this is Leslie. Oh, excuse me. Sorry. Laura Shakarian. Sorry, Laura.
Shakarian, yeah.
Shakarian, a nurse recruitment and retention at Michigan Medicine, and has been a staff nurse for 31 years. Laura, do you want to share a little bit more about you?
Sure. Hi, I'm Laura Shakarian, and I was active duty Army Nurse Corps from 1986 to 89. I was stationed at Madigan Army Medical Center, which is in Washington State. It was at Fort Lewis, Washington at that time. Now the Army and Air Force Base are combined there. So it used to be 2 separate, but I worked at the Army Medical Center there. I worked in a variety of different units and did things all the way from staff nurse to nurse supervisor, and actually did a few short deployments to cover when other staff was out in the field, and that was in Germany for what they call reforger exercises, where all the infantry and that go out, and then all the medical staff that are there have to go and support them. So I was there. I was a direct commission into the Army, so I had already finished nursing school and then joined. My husband is a West Point graduate, and he was going to be active duty, so I thought, what the heck? And so he was actually deployed in Desert Storm in the military police, and so I'm a veteran, but I'm also a military family member, and was involved in that whole thing of being a family member at home. So currently I work in nurse recruitment and retention, and I've worked at the university for 31 years.
Next, we have Leslie. Leslie, are you there with us?
Yes, I'm here.
All right, so my quick introduction for Leslie. So Leslie is currently in the Division of Surgical Oncology. She is a Navy veteran, and I have run into Leslie a few times out and about in our neighborhood, and have really enjoyed hearing her stories from when she was serving in the Navy. But can you tell us a little bit about, introduce yourself, a little bit about serving in the Navy, and tell us what's going on in these pictures here.
Yeah, thanks. So similar to Stephen, I attended medical school on a health profession scholarship through the Navy. I did my residency as a civilian, and then after completing general surgery residency, I was the ship surgeon on the USS Abraham Lincoln, and did a deployment to the North Arabian Sea in support of Operation Enduring Freedom. And then I worked at Naval Hospital in Jacksonville at the Naval Air Station. And while I was there, I went as an individual augmentee with the 1st Med Battalion to Afghanistan, where I was a surgeon in a basically shock trauma platoon. So I finished out my active duty service and left the Navy to pursue subspecialty training in oncology. And I've been at Michigan Medicine since 2016 and have a clinical practice in oncology at the Cancer Center. And in terms of the pictures, the one on the left was when it was over Christmas when I was deployed to Afghanistan. I had just been Fleet Marine Force qualified, which is kind of a fun thing to do as a medical officer. And the picture on the right is when I was returning back from the deployment on the aircraft carrier.
All right, Ken. Ken, are you with us? I'm not sure if Ken was able to join us, but he is currently a clinical care nurse on 7C in the cardiology unit. He's been with Michigan Medicine since 1992, and so hopefully if he's able to join still yet this session, then at least we'll be a little bit familiar with his face. So this is Ken.
I think he
Okay, hi.
unmuted.
Oh, there he is.
Yes,
Sorry, Ken.
sorry about that. I'm back on, I'm assuming.
Yes.
Yeah. Okay. My path is a little bit different in the fact that what I'm doing now had nothing to do with what I did when I was in the Navy. First off, I graduated from Michigan State University in 1983 in a field of packaging engineering, which I never utilized. I knew my junior year I wanted to follow footsteps of my father and older brother who had served in the Navy. So I applied for and was accepted to Officer Candidate School in Newport, Rhode Island. Went there, received my commissions, went to Athens, Georgia to become a supply officer, go through training there. And subsequent to that, I was able to be a plank owner on the USS Vincennes, which is a CG-49 out of Pascagoula, Mississippi. And then we went to San Diego, California, and I was there for 3.5 years. On board there, I was the assistant supply officer, and my role actually was in charge of the payroll. So everybody loved me because you didn't want to have me mess around with your payroll. I also owned I was in charge of the ship store. So I had all the food and everything that the sailors wanted, the barber shop. I was the helicopter control officer on the back end of the ship. It was a great time. After that, I went to Naval Air Facility in Mount Clemens, where I was the assistant supply officer there for 2 years. And I ended up getting married. I was all set to go to be a department head back in San Diego, then postgraduate school in Monterey, California. However, I got married and I said, it's enough of that. I want to get out, and was not planning on becoming a registered nurse. Actually, I was going to be an exercise physiologist, but there was no money in that field. So my wife at the time had said, Ken, you love the heart. Why don't you go into nursing? Which I immediately said, you got to be crazy. Are you kidding me? I know nothing about a hospital, nothing about medicine, but I did look into it. I graduated from Schoolcraft College. I initially was employed at Henry Ford Hospital in Detroit, waiting for something to open up at Michigan Medicine, which it did. And now I have been here for 28 years at Michigan Medicine on the same unit. In addition to that, I work at a cardiology outpatient unit in Bingham Farms, Michigan, where my patients, they do go to Beaumont Hospital, but I have sent many patients out here for cardiac transplant evaluation, open heart surgery, ablations, etc. So I've really enjoyed my stay at Michigan. I enjoyed my time in the Navy, but my path was totally different what I'm doing now from my Navy time. But everything works out for a reason, and I am extremely happy to be at Michigan. And I plan on being the oldest nurse at the University of Michigan when I retire.
That's great. Thanks, Ken.
Next, we have a dear friend of mine, Greta. Greta Krapel is a research investigator for the transplant section of the Department of Surgery. She is also, as you can see from some of these pictures, a very remarkable Army veteran. Greta, can you tell us, are you there? Can you unmute yourself and tell us a little bit about you?
I unmuted because I listened to the pre-instructions from the Marines. So I just wanted to let you guys know that I was in ROTC. I had a roommate in nursing school that was in ROTC, and she kind of got me connected. And next thing I know, I was doing like push-ups and sit-ups at Fort Knox, Kentucky. And I ended up staying in for 20 years. I was an ICU critical care trauma nurse. I moved 17 times. I've been all around the world, several different countries. My husband was in the Marine Corps, and I outranked him for a little while, which was good. And then I have one daughter, and she's a good kid. She goes to school down south because she was born when we were stationed out of Fort Bragg. That's a picture of me when I was at the 28th Combat Support Hospital. And then we decided where we were going to live when I retired. And my husband was born here in Ann Arbor, and his family's from Michigan, and everyone for 5 generations went to University of Michigan. So I went with the GI Bill and went back to school after I got out of the military, and it was just a great experience to get my advanced degree, and plan to stay here for a while. So thank you. Thanks for fun to be on the panel. Thanks so much.
And last but certainly not least, we have John. John is the Rachel Upjohn Professor of Psychiatry and Clinical Neurosciences. John, could you tell us about the photo with your children? I loved that story from the other night.
Which story?
Well, you had 1 out of 2, right? Join the military. Isn't that what you were sharing?
Well, okay, so I'll just do what everyone else has done. First, thank you for this invitation. And I am a graduate of the University of Minnesota Medical School a long time ago. My story is earlier. And I actually had 1 year of psychiatry residency, and I knew I was going to have only 1 year because I was in the last year of the doctor draft. And so I was drafted and proceeded to go to Fort Lee, Virginia. That's where you see those pictures. I was a captain in the medical corps when I went in. And I actually got very invested doing things. I was presumably going to have a 2-year term. I started doing some assessments and surveys for substance abuse, which was, half of this panel is too young to remember that era, but there was a problem with some substance abuse in Vietnam. And I sort of became a little bit of a voice and proficient and did surveys. And so the next thing I was arranged to go to Walter Reed. It was then Walter Reed Army Medical Center, not its current name. And I completed my residency there and then spent 2 more years on active duty. And so I had to have a total of 5 years. I finished as a major. The pictures are, the one that's on the far left is my son, who was wearing my other hat, and then my daughter, Sarah. And there's another one that was born actually at Walter Reed. These were pictures that were taken, I think, soon after I actually got to Fort Lee, Virginia. The one on the middle is actually a picture at Williamsburg. And why I had my military uniform on, I don't know. When we get to the storytelling, I'd love to just tell about the experiences at Walter Reed, which is basically my military time. And it's 5 years, they were very good years. And then I came to Michigan, and essentially in a way that you migrate through things. After being here only 6 or 7 years, because of partially the experiences and the CV and other things that the Army had enabled me to accumulate, I became chair in 1985 of the Department of Psychiatry and stayed chair for 22 years. And then in the process decided that I really wanted to establish the country's first medical center that was devoted to depression. So we have a Center of Excellence, and I'm the founder and the director of the Depression Center at the University of Michigan. And that's enough for now. So.
What a wonderful panel. It was such great individuals. Thank you so much. So the way that we're going to kind of go through the rest of this, Jenna and I are kind of take turns asking some questions. We're also going to allow, if there's anybody that wants to ask questions from the audience, please type it in the chat, and we'll have time to ask questions at the end as well. I'm just going to throw out a question. If anybody on the panel wants to answer this, feel free to unmute your mic and let us know. My first question is going to kind of piggyback off of what John was talking about first, but how did the military service for you influence your current job or your current role in what you're doing? Anyone want to take that on? So I'm a social worker and I'm quite comfortable with quiet.
Jennifer, I don't think a day goes by where I don't pull on my military experience. I always fall back on it. Even today, I'm planning something and I made like 3 contingency plans. You know, if something goes wrong, if the internet goes out, if something happens. So that's just one example. Just, I think, good planning, taking care of people. And one thing that I really appreciate about the military, and I really love it when it comes together at work, is working in teams. I think sometimes people are in groups a lot, and there might be in a group where one individual can make a contribution and they might, and that's good for the group. But in a team, the success of the team is the success on everyone. So I really appreciated what I've learned being, you know, a leader and a follower on a team. So I just thought that would be maybe a good way. I'd throw that out as the first pitch.
I'll take that pitch. Who wants to hit the bat next? Again, my question is, how has military service influenced your current role or job? Anybody else want to throw something in there for us?
I can add to that. I would definitely say flexibility and just being able to adapt to any situation, especially during the pandemic when it first started in the kind of like early spring, just being patient and just knowing that whatever happens, we'll figure it out, and having those multiple plans, like Greta said, has definitely helped me.
That's a good one. Semper Gumby, Jennifer would say, I think.
Yes.
Absolutely. Semper Gumby being a play off of a Marine Corps phrase for Semper Fidelis, always faithful. Semper Gumby is always flexible and being able to adapt to whatever comes your way. Anybody else on the panel want to talk about how your experiences? Laura, we haven't heard from you for a while. How did your experience serving in the military and even being a military family influence what you're doing now in nurse recruiting?
Well, I echo what the others have said about flexibility for sure, adapting to change. You have to be ready at a moment's notice just to go from, okay, we're doing this to, okay, now we're switching and we're doing something totally different. I think that's helpful, you know, in any field, but you know, in nursing, one of the big things that I learned early on being in the military was you really had to be flexible and adapt to what the situation was. We didn't have the staffing that once, you know, when I came to Michigan Medicine, it was totally different. We had very skeleton staffing, and you didn't know what was going to be hitting you that day or evening or night. And I think I've taken that with me all these years, that, you know, you come into a situation and you don't know exactly what it's going to look like, but, you know, you make it work and you figure it out. And I think the military definitely taught me that. And I think just, you know, for me, having that empathy with families, you know, patient families, you know, knowing that difficulty, because again, you know, being a military family member, a spouse during wartime, it's very stressful. You don't know what's happening over there. And of course, this was before cell phones. So I think I always had that empathy for people not, not being able to maybe connect all the time with loved ones and just trying to be able to connect with them and knowing, what they kind of were going through.
Thank you. Thank you.
All right. So yeah, thank you.
I'm
Sorry,
going
John.
to take the liberty of suggesting I have a very quick story that reflects the pleasure, I guess, and that was mostly driven by when I was at Walter Reed. I was young, but instantly given very responsible roles. The thing already described, and I think in the context of this, when I came to Michigan, there was an incident once where I was being offered the chair role, and I wasn't sure. And my 12-year-old at the time basically said, "What? You can't turn this. You're going to get more money. You're going to get, just think of all of the advantages." And I basically said something like, "Lee, money isn't everything. And it's not really what I need." And somehow it got back to, well, look how little you made when you were a doctor in the military. He wasn't even born then, he was born there. And I said, "Lee, those were some of the most pleasurable years of my life." And he said, "Oh, that's ridiculous." And I said, "I'll tell you what, I have a challenge for you." Renee, my wife, was in the kitchen, and I said, "You have to do it my way, though. You walk out and you ask Mom, just from scratch, say, so Dad and I were talking about some of your best times, your most pleasurable years. What were yours?" And then listen, and you can't say anything else. And he walked out, and her answer, "Oh my gosh, I'm really sorry." I'm going to turn this off. I forgot to do that. Anyway, he walked out and asked, and she said, "Oh, well, they're all pleasurable. They're even getting better. Come on, answer the question." And she said, "Well, you know what? Our years in the military were very, very pleasurable. They were some of the best years that we had." And he was stunned. And they really were. They were good years because you had family bonding, you had wonderful friends. We're still in touch with those people. And that's decades later. And I think the blend of, we don't have that many senior people, you're responsible. 2, take it and run with it. And 3, do a good job. And that's the kind of teaching that I've always tried to convey to residents and colleagues at work.
John, thanks for sharing that story. Leslie, I'd love to hear a little bit about some of your experiences on the naval ships.
I'll echo a lot of the comments that have already been made, similar to John, being presented with some leadership opportunities that would, outpace my, kind of academic rank because of the leadership opportunities in the military. I think the other thing that, as Cassandra said, that military experience came in extremely helpful for was planning in response and planning for the pandemic. I was part of planning for the field hospital that we're planning in the spring, and there was just so much of that was reminiscent of so many things that we did in the military, including planning for something that never happened. Obviously we didn't need to open it in the spring. Let's hope we don't need to open it this winter. But just the flexibility, the being comfortable with uncertainty, those are things that I think are critical to what we're experiencing with the pandemic. And certainly, there are a couple of my colleagues who are veterans as well, and we all felt like we were on deployment a little bit in the early spring, and so really leaning on some of those experiences and relationships.
Yeah, wow. Well, thanks, Leslie, for sharing that. And Cassandra, I would be remiss if I didn't ask for you to talk a little bit about your time in Guam. specifically maybe what you brought home with you.
So the dog in the picture on my slide, I brought home with me. There's a big dog rescue in Guam, and quite a few military will adopt dogs and even some cats and bring them home with them. So he's my buddy, and he flew across the world to come home with me. But Guam was excellent. It is actually one of the higher acuity ICUs in the Navy. So at the time, it was only one of 2 hospitals on the island. There's 3 now. But then it was one of 2, and the public hospital was always pretty full. So we actually had an agreement to take patients, like sick patients that might be closer to the Navy hospital would come to us. And it was a very resource limited place. When I first got there, we didn't have a pharmacist at night. We didn't have an ICU doctor at night. So I really had to hone in on my critical care skills there. And I learned so much in the 2.5 years that I worked in that ICU. And it was such a small place that it was just a fantastic experience for professional growth and then personal growth as well. Just being kind of isolated out on an island in the middle of nowhere. Just, having to make friends with everyone and rely on those people to be your family while you're thousands of miles away from home. And being so close to Asia, I traveled a lot. I never thought I would do that. So traveling to Asia with, just a few people, and I just grew leaps and bounds, both professionally and personally there.
Who else in our panel has a great, couple of minute story to share with us about what your experiences were like? Also, if anybody on our panel or outside of our panel, any of our visitors who are watching this, if you have any questions, please feel free to unmute yourself and ask a question or type it into the chat and we can help facilitate that. Matthew, we haven't heard from you. Tell us a little bit about, do you have that military story that you like to tell people when you talk about your service?
I can't say that I have that military story, a specific one that jumps out. I would say that going into medicine in the Navy, I was a little, concerned initially of, what the training I was going to get. And I thought that my exposure and training was phenomenal. And I would echo what a lot of the other faculty have said, is that you're kind of forced to grow. And it's such a wonderful place to start your career because you are forced into leadership roles and forced into clinical practices that are challenging, and in other situations might go to senior partners or other hospitals. But in the military, like if you're in Guam or if you're deployed on a ship, it might just be you to handle that situation. You always have people that you can lean on for advice, but it is good for, I think academic as well as professional growth to be exposed to that early on and repetitively exposed to those experiences. So that's what I, kind of look back on most on being able to grow as a surgeon and a professional in academics during my time there. And I would say one other thing that the military definitely taught was patience. Being on a ship, you learn, to hurry up and wait in line. And the military taught me patience. And so when I hear other people complain or worry about little weights or other things, I can just sit back and smile because I know I've definitely dealt with much worse. And that experience, I think, makes me better at my job today.
Thanks so much, Matt. And we have a question that came in through the chat from Michelle asking how the transition was from practicing in the military to practicing in a civilian setting. Would you say that you feel as though your colleagues don't necessarily understand your background or what your experience was? Does somebody want to jump in on that question?
I can quick answer because I'm still unmuted, but I'll defer to the other ones. For a surgeon in the military going to a surgeon in an academic setting, obviously some of the military portions are different, but the actual practice of medicine and the exposure to that is very reassuringly the same. I went from an academic facility in the military to a surgeon at Michigan, and I felt like it set me up very well. I was able to have leadership roles, which help with your ability to come into an institution prepared. And I thought that military medicine set me up very well to be at a civilian hospital.
That's Somebody else want to talk about
I'll
their
make
experiences?
Yeah,
Leslie,
I'll make
sorry.
a comment on that. I mean, I echo what Matthew said, like the clinical medicine part of it is, very similar. We call instruments the same things. We do, write orders in the same way and whatnot. I do think there's a tendency for colleagues not to quote unquote get your background experience. But I actually think a lot of that is our fault in not articulating it. And when I realized this for myself was when I first, was transitioning into this job and was here early on faculty, I had summarized my 4 years of active duty, including multiple leadership positions and 2 deployments, into like 4 lines on my CV. And I remember it was when my chair, who was very much an advocate of me, I mentioned doing something in the military, and he's like, "What? I thought you just were just hanging out on a ship for 4 years." And I was like, it dawned on me that I had allowed him to fill in gaps about what I had done, and those weren't accurate. And so now I've kind of expanded that section on my CV to about a half a page detailing all of the leadership positions I had, what I did, who I took care of. And so we did residency interviews today for our program. There was a Marine veteran who's applying medical school, applying for residency. And, I really encourage all of those veterans that are in that position to not back away from your experience as a veteran, and to not be, I think we tend to downplay it, and to not do that, because our civilian counterparts aren't necessarily going to fill it in accurately themselves.
I think that's a wonderful point, Leslie. I know that with my own personal experiences, I found that service members are some of the most humble people that I've ever been around, and really being able to emphasize how just amazing you are is a really hard thing for people to do. There must be other people. How about we haven't heard from Ken for a little bit. Ken, you must have seen some of this too, especially when you were transitioning from one career to another. How did you really stress the military experience and what you had, even though it wasn't in nursing? How did you stress that to really make people understand how amazing you are?
Well, I think in the military, you learn so much about discipline, organization, planning, flexibility, and I've tried to take all that into heart. And probably the biggest thing is just the discipline that you obtain there. And it's every day in the hospital, one of the first things I do when I go to my patient's room is I have to organize it. I cannot have a room that's disorganized. And I will often get asked many times from my patients, were you in the military? Yeah, yes, I certainly was. So that's been a trait that I've longed to have, and I thank the military for that. Being able to get along with individuals also of different race, because in the military, you're a team. There is no I in team in the military. It's everybody is in it together. You don't have the time to be messing around, especially when you're on board a ship and you've got an unrep going on and you've got supplies coming across and you're not paying attention. One small move, that line that's carrying those items across the ship can snap loose and just, major injury. So the discipline has probably been the biggest thing that I've maintained in my life. I'm somebody who gets up 2:30, 3 o'clock in the morning, do my exercise, do my reading, go to work 12 hours, come home, and do it all again the next day. And I believe it's the military background. It was tough transitioning from being an officer in the Navy to directing individuals underneath me to becoming a staff member on a unit where I was now, working with other people but not being able to give orders as much. But the orders I wouldn't say orders, but when I would try to direct my nurse techs or other individuals, and they wouldn't do the job, I think, as easily as one of my employees, my members in the military on the ship. It was kind of hard for me to transition to civilian life because I'm just used to people, yes sir, no sir, and that's it. And it took me a while to understand that civilian life is different in regards to that aspect, but it did enable me to learn to be more flexible with individuals, and I appreciate that. And I'm not as direct as I used to be when I was in the service, but I learned, and it's been a great transition though, and I can't thank my military time enough, and I just think it makes you stand out in many aspects, and I appreciate that. And I come from a military family, and I really wanted my son to follow the footsteps, but he decided something else, and that's okay. It's not for everybody, but I'm just so happy to be part of Michigan Medicine and being able to look back at my naval career as the best 6 years of my life. And if I could do it all over again, I probably would have stayed 20 or 30, but we all make choices. But I still look back very fondly on my time, and I love doing what I'm doing at the hospital right now, and it's just been a great life so far. And like I said, I really plan on being at Michigan Medicine for quite a while, and it's kind of where I'm at.
So Jenna and I are going to turn this over to the audience to ask questions. But before we do, I'm going to ask all of our panelists to unmute their microphone, and I'm going to ask you a very quick question while everybody else is formulating their questions. But if you had one word to describe your experience as a veteran, what would that word be? Ken, you're still unmuted. What would your word be, Ken?
Well, my one word would be proud. I'm proud to serve my country. I'm proud to say that I was in there for 6 years, and I did a lot for my country, and I love that. I'm proud to be a member of the United States military, and personally, I think that it would be a good experience for every high school student to go into the service for 2 years, and just serve your country. Because I'm proud. Proud is my number one word.
Cassandra, how about you?
I would say empowered.
Matthew?
I would say grateful.
Laura?
Oh, I was gonna say proud as well, but I also will add then, because we've used that one, leader, because I think whatever you did in the military, you were a leader, regardless of what your job was, your rank, you were expected to lead. So I'll say leader.
John, what would your word be?
Confident. Everything that you were challenged with, you were expected to do it. Confident.
Leslie?
I would have also said proud, but I'll go with perspective. I think the worldview perspective that you get through service is second to none.
And Greta?
I would say the same as Matthew. Hate to be a repeater, but for me, it's grateful. That's the first word that comes to mind for the people I've met and for the opportunities I've had to serve.
I know it's hard to sum up for many of you decades of service and those feelings about it in one word. But now let's open it up. Jenna, what do you say? Let's see if people out there have any questions for us.
Jen, there's a question for you. And Jenna, what's your word?
I do see. So there was a question for Jenna and myself to give a word to. So my word about being a veteran very closely aligns with everything that people have said. It's empowering. It's empowering to be able to say, this is what I did, and this is something I carry with me forever.
And I am not a veteran, actually. However, in these experiences and these opportunities that I have in working with all of you and in supporting these initiatives, I certainly feel humbled. So.
Good, let's open it up. Who has questions out there? I see lots of people in our Zoom audience. Who has questions for this phenomenal panel that we have with you guys today?
Jennifer, while people are putting in questions, one thing I thought I could add about the transition from military, because I was in the military for a long time, and when I first was looking for a job, the person said, "Oh, okay, yeah, we'll give you a job." And I came home and told my husband, I was like, "Hey, yeah, I got the job." And then I followed up and they were like, "Oh no, it's not going to work out." And I was like, man, I thought a handshake is a handshake, I'm like,
Yeah.
I didn't, but that was again, back to Leslie's point, that was I just wasn't used to that at all. I was just, if someone said they were going to do something, they were going to do it even if they rank higher than me. And then I thought another thing is that my staff always says to me, and they laugh because I'm like, not an emergency. It's not an emergency. And I know Pat said that yesterday in his, but they laugh at me about that. I think that, you learn to prioritize and you know what is a real emergency, and you've been in real emergency situations, and hasn't been any since I've been here. So there's always time to think. There's been time to think. So
I think that's a great way to talk about it, Greta, because there's definitely stress, and then there's stress, and there's additional stress. And so not all
Yeah.
stress is the same. And
yeah,
the way
that
you
video
take
that we saw and that other thing, that's stress. Yeah. So I
For those
just
that
wanted
are-
to add that.
For those that are joining a little bit late, there was a panel discussion earlier this week that had a video that talked about what it's like to be a medical professional on the front lines. So be sure to click back onto that link and you can watch that video as well.
Trust in your team is, I think, a lesson that also, it's not one word, that's kind of what I was trying to say earlier, because you sort of recognize that you are, maybe it's why I came to Michigan, I don't know, after leaving Walter Reed, but the team. And I think there is a recognition that you can trust in people as long as you sort of are behind them and ready to delegate and those things. And I have some great stories from my experiences at Walter Reed that illustrated that.
Any questions from our group here, or even the panel members? Like if one of you had a question from one another, this is a good opportunity to ask other veterans as well. So. All right. Well, then in the meantime,
I'm looking at. I'm looking at one of the people who has signed on.
Uh-oh.
and that's Michelle Keys, and I mean several.
Yes, sir.
Yes.
So a panelist has a question for the audience member. It would
There we go. That sounds fabulous. What do you have, Dr. Graydon?
Well, actually, I was going to say, you have described some things to me that made you develop a phenomenal loyalty to want to help the military. Describe it.
So certainly we have, so allow me to introduce myself. I am not going to take the opportunity to turn on my camera because I was working out immediately prior to this call, so please forgive me. My name is Michelle Keys and I'm a clinical psychologist in the Department of Psychiatry, and I am currently the director of MSPAN, Military Support Programs and Networks. And we have, over the last 12 years, been fortunate to work with donors, foundations, and federal funders to develop a comprehensive program that includes a number of different evidence-based interventions specifically addressing military mental health. And several of our programs are really focused on women and resiliency, and that has been incredibly inspirational for our team. Jennifer works with me on that team, and she and I have had some opportunities to engage with large cohorts of post 9/11 women veterans and hearing their stories. And it's quite life-changing when you can work with some of these women who talk about struggling in their transition from the military into the civilian world, and knowing that sometimes what it takes to succeed in the military world is different than what it takes to succeed in the civilian world. And yet they are smart and strong and have grit and resilience that has been quite an honor. And much like Jenna said, has been very humbling to be able to work with these women and to be able to continue to serve them. I know there's a talk later this week as well, as part of Veterans Week, that Phil so graciously has put together and Jennifer's collaborating on, specifically for women veterans. So I hope that some of you are able to join that talk later this week as well.
In case anybody is interested, I am throwing up the website that Michelle is talking about for MSPAN Military Support Programs and Networks. One of the things that's really amazing about the work that's done at Michigan Medicine, and some of the stuff that John has been able to really ensure happens here, is to have programming that's developed to benefit service members and veterans all across the country. And so it's quite something when we think about Michigan Medicine to be able to work in that field as well. All right, we've got lots of people here. Who else has questions for this panel? And fair warning, I guess if you don't have a question, one of the panelists might ask you a question. So let's hear your questions.
You mean like I just did?
I'm always curious about the why did you enlist if you had that choice, right? So if somebody would like to share their why or what drew them to, I'd love to hear a little bit about that.
I can answer that. I'll answer that one. So the major why is the cost of medical school education. But in terms of why the Navy, my dad is a veteran of the Navy, and he was enlisted in the 60s and then spent the rest of his career as a Department of Defense civilian employee. And I did have a really cool once in a lifetime memorable opportunity when we were returning from our deployment on the aircraft carrier. There's a tradition of what's called a Tiger Cruise, where you can invite family members onto the ship. And so I was able to invite my dad. He flew and met the ship in Hawaii, and then was underway with us from Hawaii to San Diego and then back to our home port and out of the Seattle, Washington area. And so about 7 days we got to spend together on the ship, which was an amazing, experience. As this small piece of Navy trivia is the only person, the surgeon is the only person that the ship cannot be underway without, because anybody else, the CO can be replaced by the XO can be replaced by one of the other, department heads, but nobody usually can take the place of the surgeon. But because of that, it's a very high profile position. The CO knows who the surgeon is and knows your whereabouts. And so because of that, my dad, he also is very social. And so he would send me pictures. He made it up to the captain's chair and got to kind of be a little bit of a celebrity on the ship. And at the same time, got to go and do the things that he had done when he was enlisted. And so that was cool. And he had a lot of influence on my choice.
I see a question here that is for anybody on our panelists that wants to answer. The question is, are there any lessons that you've learned or carried with you through your transition from working in healthcare in the military to working in healthcare in the civilian realm?
I'll be brief, I hope. I have one that I'm sort of living with still. I mean, I had the privilege of, in 2007 and 8 when it became apparent that returning veterans were experiencing problems with PTSD and depression and increased suicide risk and stuff. And I got a call from Fred Wilpon, who owns the New York Mets, and he had taken his players to Walter Reed. And I had known him, and he basically said, we cannot lose another generation, and let's do something. And I sort of found myself, I had plenty to do, but I wanted to volunteer. And after that, it just became delegation to the Michelle Keys and the Jane Spinners and a whole variety of others in the world. And everybody in my world kept saying, why are you doing this? There's a VA hospital. And I responded, we all have a responsibility. And I think it's been among the more rewarding aspects of everything I've done in medicine. Thank you, Michelle Keys.
I think what John talks about is really important because for those of you that aren't familiar with it, not every veteran gets their care through the VA hospital. And not every veteran, especially we have some women on this panel, and women have long fought for their recognition when they go to the VA hospital. And so many do seek their care outside of the VA. And so it is so important to realize that, you know, when you look at a screen like the screen you're looking at now tonight, anybody that walks into your office or into your life could be a military veteran and could be worthy of those services that you'd like to offer, that you expect is offered. I do like Emma's question. I'm going to ask it, see if anybody else has anything to add to that. But Emma's question was, are there any lessons that you've learned or carried with you through your transition from working in healthcare in the military to working in healthcare in the civilian realm? Anybody else want to tackle that question?
I'll just say, I think I alluded to it earlier, but I think that, you know, and it may be different now, like, because it's been a while since I've been active duty, but the resources are so different. When I was at the military hospital, I mean, the resources were, and I'm talking human resources, people, were scarce. You did not have the staff that you have. When I started at Michigan Medicine after I got out, I was amazed at the amount of staff and the amount of assistance you had. And I would work at night on a post-op unit in the military with one medic or aide, and I did everything else. And so when I came to Michigan Medicine, I was just amazed at all the resources, and I was grateful for it because you know, there were a lot of nights that it was a little scary working basically by yourself and taking care of all those patients.
So Laura, it's as if you knew what I was going to say next. So we're going to wrap up this panel, but I do want to point out Michigan Medicine has over 400 veterans employed and registered through Human Resources as a veteran that works at Michigan Medicine. There is a resource group, an employment resource group through the Department of Equality and Inclusion. If anybody on this that's here with us today, if anybody views this video later and wants information on this Veterans Resource Group, we meet once a month and talk about various resources that exist within U of M and ways to connect and to build military service pride and veteran pride. If anybody wants information on it, I'm going to throw Phil Larson out there and myself. Feel free to email either of us and we can help connect you with this group. Other than that, I know that this is a late evening for many people and that you have dedicated a lot of time, both from our panelists and all of the people who joined us, to hear what these people had to say. Thank you so much to everybody that came to this panel. I'm going to turn it to Jenna and she can close us out of here.
Yes, thank you for those that joined, like Jen said, and for our panel. You're phenomenal. So thank you all for your time this evening and for your willingness to share. Oh, sorry, John.
No, I was going to say, let's wish the Marines.
Oh, happy birthday.
Thank you, thank you. It is the 245th birthday for the United States Marine Corps. today, 10 November. So I tell if there's any Marines that are with us tonight, you look good for 245.
I want to say thanks to everybody for joining us for the panel. Thank you for the panelists. I want to remind both our panelists and especially our moderators that we do this every year. And so please book your calendars ahead of time for 2021. We probably will have you in person somewhere, hopefully, or maybe on the web. We'll see where everything goes. But I am always about us sharing our stories and sharing them with our community. And so we have 22 people on tonight. We only have about 35,000 more to connect with before we hit everybody at U of M. And so we could be doing this for a while and still connecting with people and sharing our stories with folks who haven't heard. So please consider joining us again. Please share your stories as you go through this week and throughout your time at Michigan Medicine. As we've heard tonight, I think they're important stories, and our civilian counterparts can hear these. So thank you so much again. Happy Veterans Day tomorrow. And please consider joining us for the rest of the week. But for all the vets on this panel, go get yourself at least some free food where you can. This year is going to be slim pickings, but try. Enjoy the day, and happy Veterans Day. And thank you again.
It was
And
nice
thanks to
meeting
all of-
everyone.
Thank you.
Thank you.
Nice meeting you.
Thanks.
Thank you.